Any viral fever can cause severe body pains or muscle pains. The pains are more because of the muscle soreness or muscle pain, and this muscle pain can be very serious, causing releasing the toxins and causing the blockage of the filtration apparatus in the kidneys, and that can lead to the kidney shutdown. The second and important infection during monsoon season is malaria. Malaria, as we all know, it's a parasitic infection which is spread by mosquitoes again. And these mosquitoes can spread, and we can spread this infection very fast. So, malaria can be again having fever with chills and rigors, periodic fever with some morning fever, night fever, with a gap of around 8 to 10 hours. The patient starts getting high grade fever with chills. Again, it happens because of the multiplication of those parasites inside our red blood cells, and it happens periodically. Whenever there is the parasitic load is increased, there could be rupture of these red blood cells in the blood, and then it can cause release of the certain components from the red blood cells, which can cause jaundice, and indirectly it can lead to the kidney effect also. Again, the blockage of the glomeruli, which is the filtration apparatus of the kidney, and that blockage can lead to sudden kidney failure or sudden renal shutdown. Third important infection is leptospirosis. It happens because of the entry of these leptospira through the aberrated or the injured mucosa or the skin. So it can happen when we walk in the stagnant water which is infected with these leptospira organisms. They enter through our body through the skin cuts on the legs or mucosa, or even through the eyes. So they enter in the body, and then they cause damage throughout the body. It is mainly because it mainly affects the liver as well as the spleen. There is a spread of this infection, and then it has an effect on the kidneys also. So in all these infections, there could be kidney shutdown because of dehydration or because of the direct toxic effect of these infective organisms on the kidneys. These infections can cause kidney failure of various range. It can be of a temporary nature, or in few cases it can be of permanent nature too. It can be very mild, like a slight increase in the creatinine what we see, and then with the prompt therapy it is reversed back to normal. So such scenarios are also seen, or the advanced cases where there is a complete shutdown of the kidney function and where the dialysis is required, though it is a temporary type of dialysis in such scenarios, but it is a saving measure when there is an acute shutdown of the kidneys in this infection scenarios. Let us see who all are the at risk for these kidney problems in these monsoon season because of these infections and because of this gastroenteritis and other kind of infections. So, extremes of ages, very young children as well as very old people, they have less immunity. So, they are at risk of any kind of infection during this period. Second is patients who are diabetic, who already are susceptible to the infections. Third thing is patients who are having kidney diseases. They have a compromised immunity already, so they can cause infections easily. Pregnant women are another group which can get these things. Very obese people, smokers, alcoholics are at risk of getting these complications during this infection.